Degenerative meniscal tears are really common in middle-aged and older adults. The meniscus is a thick pad of shock-absorbing cartilage within the knee joint, and these meniscal tears that happen in middle-aged and older people, they're distinct from the sudden traumatic meniscal tears that might occur in a younger person as part of a sporting injury. So a meniscal tear in somebody age 40 and over, it usually occurs gradually over time, and it's not necessarily accompanied by pain. So we know that about 20% of people who are age 40 and over will have a meniscal tear, and this rises to as high as 50% in people that are age 70. And these are adults that have no pain and have never had a knee injury. And often, this change that happens to the meniscus is usually described as a fraying, and it's accompanied by a suite of other changes within the knee joint. So the articular cartilage, which is the smooth cartilage that lines the bone ends, that can develop, defects, and also the subchondral bone, so the bone underlying the cartilage, will change. And so while these changes that occur within the knee joint aren't necessarily painful, sometimes pain can develop, and often we can't identify a cause, but sometimes it can be because of an increase in physical activity or exercise, weight gain that has happened, a minor twisting injury, or potentially a change that's, put on the knee at work. So for example, more squatting or kneeling or prolonged standing. So the prognosis with these type of meniscal tears is really quite positive. The good news is that these structural changes within the knee don't have to reverse for a person to be pain-free again. So often symptoms will settle gradually with time, and for the majority of people, it can take up to 6 months for them to make a substantial improvement. Some people will improve quicker than this, and some people it will take even longer, over 12 months. There is a subset who tend to have more persistent pain, so this is about 1 in 10. And really what identifies these people is people that have more osteoarthritic changes within the knee joint. If the meniscus is extruded or has extended beyond the margins of the joint, that can be something else that's associated with, a poor outcome or recovery. Things like low mood or a higher BMI can also be associated with having more persistent pain. But overall, people can have quite positive expectations of making a good improvement with this type of diagnosis.